Hello everyone, welcome to my YouTube channel. So today we'll be talking about foot drop. So foot drop basically means unable to take your foot up. That means this is the dorsiflexion. Whenever there is a weakness here or nerve injury or muscle damage or any after fracture, usually it happens due to your neurological disorders, myopathy or any neuropathy, compression of the nerve in the disc in your lower back. It can cause often this. So in stroke patient, you all have seen, I think so, whenever they try to walk, they'll work in this pattern because they are unable to take the foot up. So I'll give you some effective exercises and tips which may be helpful for you all. So the first tip what I'll give for foot drop is always start the exercise as a standing position, because when you are in the standing position, your muscles are already activated and they are ready to stabilize the your body. Whenever you take a stand and whenever you're doing any exercises for a foot drop patient, start the exercises in the standing position beside sitting and lying. So we'll take the option sitting and lying for now away. Now you'll start with the standing exercises. So the second tips which I'll give is see for reflex if it's present in the foot. So how to check that, and if the grade is 1, if there is more than 1, that will be present. So ask the patient or the person whoever is suffering from foot drop, you have to tell them to lean back. When you lean back, you have to ask them to be on the heels. When they do be on the heels, the foot automatically comes up. So that's your reflex. Your body is using you to protect you. If this is present, so this is the second tips. You have to use the reflex to activate the muscle. If there is grade 1, it will be present in most of the cases. And the tip 3 which I'll give is, what will happen is when there is a foot drop, we'll focus only on activating the muscles of the foot. So what you can do is, if the person is unable to activate the foot, you can ask or take the surrounding joints, the knee joint or the hip joint, towards the ankle. So this is the ankle drive. As you can see, I'm unable to do the dorsiflexion, right, when there is foot drop. But instead of that, seeing the problem here, what I'm trying to do is I'm taking the knee away here. Eventually this is happening a dorsiflexion here. So we call it at a this is ankle drive. So you can use this other body, you can take it towards the ankle. Suppose you'll step on a stairs, then you'll take the body towards the ankle. You get it what I'm trying to say? That means don't do only the exercise on the foot. See how you can bring the knees and other part of the body towards the ankle. That may give support and weight bearing for the, and it will allow you to activate the muscles around the ankles. And the fourth tip which I'll give you is, I'll show you the resistant band. So resistant bands, so we have a eccentric control, concentric control and isometric. So eccentric means when I'm taking it in the dorsiflexion, I'll ask the person to take it down very slow, like this: 10, 9, 8, 7, 6, 5. So concentric means when I'm taking it up. So I'll hold the resistance here. I'll ask them to do the dorsiflexion. If they are unable to do, no problem. Just assist them. Okay. So this is the concentric. Isometric, this you have to hold it in this position only. So take the resistant band, hold the foot in this position. So this is the isometric hold. So you can be there. The next thing is eccentric, concentric and isometric holds you have to teach. Instead of, if the person is unable to do the dorsiflexion, work on the eccentric control. That means you'll take the foot and ask the person to take the foot down. So we're causing a lengthening of the tibialis anterior and calvis activity. Okay, in this way we'll try to modify. And the fourth which I'll ask you to do is, for a patient, is we'll use an irradiation. So irradiation technique means whenever there is a problem, suppose we have a problem in the right side, we'll teach how to use the left side to convert the energy in this leg. Suppose I'm asking you to fall it back, so I'll take my hands down, I'll be against the wall. So when I'm doing this, automatically my heels are coming up. When I'm doing this, my automatically heels are coming up. So if somebody is there, or when you will be there, so if my right side is problem, restrict the left side. Suppose my legs will be here, so I'll tell them to move behind. When they are moving behind, this is affected. it won't come. So what we are doing is we're restricting the left side to activate on the right side. So when I'm leaning it down, so that if there is a visual effect, okay, I'm putting my leg, this is the therapist's leg, my leg is there, just imagine that. So when I'm going there, I'm restricting this. When I'm restricting this, that leg is coming up, but while doing that, we're activating both the muscles. Okay, and now we'll start with the exercises. First is the weight bearing exercises, okay, and we'll use the reflex. So you'll ask the patient to stretch the arms out and lean the body towards the, or you can say lean the back towards the wall. When you do that, automatically the heels, the foot of your ankle comes up, as you can see, and they have to be rested on the heels. Again, same thing. So this you can do 10-20 times. Okay, ask them to lean, just ask them to fall against the wall, and make sure you're supporting on the side. So go, because they usually have. And the second one which you can do is, you'll take a resistant band, the same thing which you'll do. This is the easier one, but you just hold the band in this and ask them to be on the heels. Okay, and ask them to be on the heels. Hold it there and relax. Again, ask them to hold, lean the body forward and take it up. Okay, so what we are doing is we're pulling the band and being on the heels. So we'll ask them to be in this position. So this also you can make them to do 10-20 times. So next, putting the band on the ankle drive and ask them to hold the knees and move towards the ankle. Take the knee towards the ankle. Okay, here what you have to do is, the ankle and the knee will be perpendicular to each other and the knee will be moving forward in this position. So you can be there, hold there for isometric. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, relax. I don't have a stool. You can ask them to step the gate, come back, step and come back, step and come back. So all these things, you can change the direction if you want in this position. And if to make it little bit harder, what you can ask them is, be in an uneven surface. Uneven surface means put a pillow or something, or towel or something. Next what is gonna be is, you'll ask them whichever leg. So we'll take an example, my left leg has a foot drop, so it will be on a block or a tool like this. So it will be already in a dorsiflexion. After that, what you'll ask them is, hold something, move forward and come back, move forward and come back. So in this position you can do the exercises. Okay, and one more thing what you can add is, you can act the band while doing this exercise. Go front and come back, go front and come back. You can use the same uneven surface, be on there and try to balance. Ask them to balance. So this will activate the muscle responsible for stabilizing, and this will help you in the proprioception of the ankle. So there's various ways you can use uneven surface. So you get that Swiss ball and stuff. You can ask them to stand on it with the support with yourself and just ask them to swing the good leg. Swing the good leg, or if they want, they can bend little bit, this much. Bend the knees, not so much, they should not go, only this much you can ask them to do. This is the next exercise. You'll be putting the band around the ankles and you'll ask the patient to take the ankle in the dorsiflexion if they can take. If they are not able, no problem. You'll just ask them to be on the heels as much as possible and try to make an O. Ask them to make a O with the legs, how much ever is possible. And after this, what you'll tell them is, you'll hold it here in this position, you'll cross. Now you'll do for the hip flexors. When you are doing the hip flexion, knee flexion and ankle dorsiflexion, this will automatically activate the muscles. So here again, after this you'll do a heel slide. That means heel slide in this way, one heel of the leg on the other heels. You'll ask them to do in this pattern, go up slow and gentle. Ask them to control. Whenever you're doing the eccentric control, take it down slowly, again be there, again concentric, again go down slowly. Ask them to focus on the eccentric control, how much ever possible, and relax. So you'll ask them to hold a towel in front of you in this way, put the band both on the side, get little bit resistance, and pull the towel towards you. Ask them to curl the toes, or if you can ask them put some objects like a pen or marble or anything or tissue paper which are able to grip by the toes. Okay, so you'll ask them to grip the toes and bring the marble towards and behind. You can go front, ask them to grab the towel and bring it behind. Now next, ask them to grab the marble and bring it behind. And you'll keep a small cup or a bowl in the side. So again, same thing, hold the marble, go up and keep it there. Again, come back, take the another marble, hold it there and come up and keep it there. Same thing, take the another marble, come up and keep it there. Okay, so this way you can modify the exercise by yourself. For now, I'm using a block, so you can use a tool, a small tool. Stabilize the knee, go little forward and come back. Go little forward and come back. While doing this, you can use a electric stimulation. And whenever there's a foot drop, don't make the leg, just keep it like that and do. Use the electric stimulation while doing the exercise. Suppose I'll put my muscle stimulator here and do the exercise while doing this. Okay. So that's way whenever you activate the muscle already activated and doing the exercises, it will activate the surrounding muscles and nerve more properly. So you can do this while doing the exercises, put the electric stimulation. So the next exercise I'll be giving is to ask the patient to be a little in squat position in this much. And try to sway the body front, back, left, right, front, back, left, right, front, back, left, right. So in this way you can modify the exercise by yourself. Actually the weather is very hot, I'm unable to film the video. So last option what you can do is you can ask them to wear the ankle knee splint to the dorsiflexions. That means when we're shortening the muscle here by wearing the splint. So you can ask the patient to wear the splint. And the last tip which I'll give you is whenever there's a foot drop patient, ask them to keep a pillow, two pillow in the elevated plane. That means you have to ask them whenever they are slipping, elevate the legs and slip. Okay, while wearing the night splint. So in this way also we are trying to decrease and check for any swelling or edema in the surrounding legs and foot, because whenever the muscles are not activated they are unable to pump the fluid. Okay, there's no enough flow or there's a restriction in the flow, so you have to check for edema and stuff and look out for that. I'll show you rest of the video in next because the weather is very hot. Thank you for watching. Thank you.